You all know where the restrooms are, but we're going to ask Dr. O'Toole to come forward. It'll be a pleasure for me to introduce Dr. O'Toole. I've known her for quite some time. Their areas of interest and expertise are pretty well documented, broad range from biodefense to cybersecurity. So, Dr. O'Toole, great to see you again, and thank you for joining us this afternoon.
Thank you, Governor. Is that on?
No. I don't know. It doesn't sound like it to me.
Okay.
All right. Good.
I see why everybody's confused. So, I prepared some remarks which became overtaken by events around 10:30 this morning. So I'm going to try and sketch a few thoughts, some of which emanate from the previous discussion. And I want to start by acknowledging all of the current and former government officials and colleagues, current and former, in the room, and just echo the observation that's been made by many on the panel, which is the importance of individual initiative in this. A lot of people in this room have been heroes, mostly unsung, and that can't stop. I would also note that most of us are closer to the end of our career than the beginning. And maintaining the momentum that we have, such as it is going to require the recruitment of a lot of talent into the government and elsewhere. I want to make a couple of points. First of all, we've talked about the evolution of the threat, and it is evolving because of the social and commercial factors that Steve Redd mentioned, and our increasingly frequent encounters with new organisms. It's also evolving because of the trajectory of what I'm going to call the biorevolution, which I think is the missing elephant in the room. We are getting increasing ability to manipulate organisms and indeed life, and that is going to translate into a bioeconomy, which will give a lot more people access to the skills and knowledge needed to manipulate organisms. But the bioeconomy and the biorevolution are also the way through this perilous time. And we have not done enough to take advantage of the advances in science and technology that are happening and that could happen. So I'm going to speak mostly about technology, which we haven't talked about much today. And indeed, public health has a penchant for focusing on process and consensus and policy for good reason. But I want to suggest that we can get an awful lot of power from technology if we thought about it more and built the infrastructure necessary to capture it and put it to use. So I'm going to make a couple of main points. First of all, I want to talk about the technologies that we could have in the next 3 to 5 years that would give us significant improved capabilities in the managing of epidemics, okay? And this would take money, a lot more than we're talking about today, but nothing compared to line items in the defense budget. And it would also take a new approach to the public-private infrastructure that we need, that Dr. Lillybridge mentioned, and I'm going to come back to that. To frame the conversation, let's just imagine we're in an epidemic. We know we're in an epidemic, and we need to manage it better. And indeed, this is a skill set we've been working on for decades now and have gotten much better at. But again, if I had to pick with my magic wand, I would give us 3 sets of technologies to give us a significant improvement in our ability to manage epidemics, naturally occurring epidemics of infectious disease. First, we, meaning everybody who is involved in epidemic response, including academics as well as public health officials and politicians, need to do a much better job collecting and using information to guide decision-making and response actions. There are lots of technologies already in use in the commercial sector that could aid us in this endeavor and help enable real-time data collection, improve the speed and quality of data cleaning, and provide useful analytic tools to better manage the epidemic. Better data collection and use would get us more accurate and useful situational awareness, inform better decisions, and enable learning. A key task is to build an information supply chain, as my colleague, Dr. Dylan George has called it, that reliably and efficiently collects, curates, and flows key data, not all data, key data, to decision makers in close to real time. There are, for example, commercial technologies that convert analog data, the type of data that comes in on pieces of paper from the many different countries and clinics in West Africa during the Ebola epidemic, into digital data that can be aggregated and analyzed. There are many more that I could mention, but traditional public health practice, which is all about data, but mostly retrospective data, has not incorporated these technologies, largely because of money and our failure to recruit the kind of data scientists we need into government, which, believe me, is no easy task. A senior government official who was very important during the Ebola outbreak told us that the data were essentially useless because they were incomplete, they lagged for days or weeks, and they weren't trusted. We have got to, and we can, change that. One of the biggest problems in building a robust information supply chain during epidemics is cultural. How can we institutionalize the imperative to share data during an outbreak? The science culture is to hoard the data, to work it very carefully so that you know what you're saying can be backed up, and then publish it in a prestigious journal, usually months after the event. That has to change. We have to figure out a way of rewarding the sharing in data. And in fact, this is a broad and compelling need across not just the public health, but the biomed community. We were talking to a senior pharma official very involved with innovation recently, and he said if he had one wish, it would be to open all the data that NIH has, failed experiments as well as successful, so that everybody could get at it. So this open data problem is going to beset us and be a big issue in public health and biomed in the years to come. And we can take a lot of lessons from physics in that regard. The second technology I would wish for was mentioned in your excellent letter to Congress, namely rapid readout point-of-care diagnostics. Diagnostics are absolutely critical to managing epidemics because without them, you really don't know where you are, where the epidemic is going, what's working, what isn't working. And if you don't have countermeasures, it is very difficult to figure out how to institute the so-called non-pharmaceutical interventions without knowing who's really sick and who isn't, particularly at the beginning of an epidemic, when the clinical signs are not clearly known and you're trying to figure out how big a problem you have and where to assign resources. There's lots of diagnostic technology out there and more coming. CRISPR, for example, opens up the possibility of having on-demand diagnostics at point of care for pennies. The reason we don't have diagnostics, and this is a problem that plagues medicine, clinical medicine, as well as public health and epidemic management, is a market failure. It costs almost as much to create a new diagnostic and get it to the through the regulatory regime as it does a therapeutic, but the return on investment is much less. And there are also very significant business hurdles To get compensation for a diagnostic takes years because you have to go through one insurance company after another. And so people in the biotech industry have just pulled out of the diagnostics business, and this isn't going to get fixed without intervention by government. And probably it isn't going to come just from BARDA and from CDC. FDA needs to get involved, and the Congress needs to get involved. And the third technology focus for the near term that I would urge is vaccines. We are not being sufficiently ambitious. And I say this knowing that Rick Bright, the very able director of BARDA, is behind me, as well as Dr. Red. Okay, it's not that they wouldn't be sufficiently ambitious, but we have got to fund the capacity to design and rapidly manufacture vaccines on demand and at scale. That should be our goal, not yet another vaccine for another virus that pops up. This is the only way we're going to get ahead of these threats, whether they're natural threats or deliberate threats. And goodness help us if we actually confront an engineered threat. We need to be able to make vaccines. They are more important in managing epidemics than therapeutics, and I think the private sector will step in and address therapeutics when the need arises, but they are much more complicated and expensive to make than vaccines. We have new technologies. You heard mention of new kinds of vaccine technologies from the previous speakers, and I'm not going to go into details, so I'd be happy to. We have new technologies based upon the booming market, by the way, in vaccines, which is worth about $37 billion globally right now, and our increased understanding of the immune system that we could leverage to take care of this problem. But it's got to be, as Scott said, more of a NASA and a moonshot than the current slow-mo pace, year by year, arguing for every dime in the BARDA budget. So those are my three near-term technologies. Long-term, as I said, we have got to take advantage of and pay attention to and recognize the biorevolution that is underway. The biorevolution is going to transform the global economy, much as the digital revolution has done. It will bring tremendous and wide-ranging benefits, and it's going to be essential to solving some of the world's biggest problems. The US government has financed most of the basic research that has made this biorevolution possible. We have spent $1 trillion on basic biomed research since 1938, according to Forbes. And I agree with Dr. Lillibridge, we're not getting our money's worth out of it in terms of products, which I will come back to. But this biorevolution, this capacity to read, write, and edit the code of life, to understand how living organisms work, and to take that knowledge and engineer it predictably to make ourselves new materials, new forms of energy, new ways of farming, et cetera, et cetera. This is going to touch multiple industries, and it's going to be one of the key economic platforms of the 21st century. And we are not awake to it. We are not awake. And the greatest threat from bio is not an attack with an engineered organism. The greatest threat, in my view, from bio, and I've been working biodefense for a long time, is that we fail to compete in the bioeconomy. This is not going to be just another technology coming online. This is going to be what the economists call a general purpose technology, like the steam engine and electricity and the internal combustion engine and digitization. And we have got to recognize that we're going to have to build a new infrastructure to support and encourage the translation of the basic bio, which we have been so instrumental in creating, into useful products. This is going to require a new set of institutions and new forms of organization and new relationships between the government and universities and the private sector. And the private sector in bio is quite diverse. It includes big pharma, who have their own problems struggling to innovate in a cost-effective way. And these small startup companies, these biotech companies that have done so, and some of whom have grown into big companies, who've done so much to innovate in the area of the life sciences. I just want to point out that we have not supported the translation of biology the way we supported the translation of physical sciences in the US government. We haven't built the DOE national labs for life sciences. We do not have a DARPA. We have a BARDA, who wishes they had DARPA's budget, for far-out biology. DOD has 7 categories of line item funding for R&D. We've got individual investigator R01 grants in NIH and BARDA in the Valley of Death in biology. So we do need to rethink this translational infrastructure that has powered our economy and the physical sciences for the last half century, really since World War II, and how we're going to build such a transformative infrastructure for the life sciences. And I'll end by saying that other countries recognize the economic engine, which is biology and biotech. China, in particular, has told a senior American scientist that the UK owned the Industrial Revolution, the US owned the digital revolution, China will own the bio-revolution, and they are building and recruiting to that end. You heard about how they are bringing primate specialists back to China. They have a 10,000 talents program that is trying to suck up not just ethnic Chinese scientists, but American scientists, scientists from all over the globe, and give them money and lab support and so on and so forth to buttress their biology and biotech infrastructure. They are systematically building the institutions they need to do what's called synthetic biology, and they are engaging their private sector in a way that's unique to the Chinese, so that you can't really tell the dividing line between their companies, their private companies, and the government. But they are moving strategically, very determinedly, and with purpose, and they're going to win. And to your last question, Governor, machine learning and deep learning and artificial intelligence are absolutely critical to biology. Biology is big data. 3 billion base pairs in the human genome, 1 human genome. You start doing big cancer projects or projects involving multiple genomes, and you're already talking big data. To really understand the natural phenomena behind the genome, we're going to have to do very big experiments indeed. And because genomics, which is one of the foundational sciences of bioscience, involves such big data, then, you know, machine learning plus bio, deep learning plus bio, AI plus bio are absolutely an essential stop on the road ahead. So to sum up, there's lots we could do. It's going to come, the answers are going to come from the goodwill and earnest efforts of people working collaboratively, certainly, from our public health organizations who do so much with so little, but we are ignoring technology too much. We are failing to incorporate the capabilities that are already out there and to build new ones. And most importantly, we are not poising the country to take advantage of this revolution that is already upon us.
Thank you, Doctor. Thank you very, very much. I'll change the order. My colleagues to my right, any questions?
Yes.
Yeah.
Thank you,
Tom. Please.
I have 5 questions.
Great.
And I think we're like-minded, so really these are just to prompt you to say more. So I won't have to talk about them instead. But I'll just list them out, and maybe you can remember them. I'll remind you if you don't. You kind of mentioned information for decision makers, and I think some of our earlier speakers talked about actually they had huge delays while the decision makers were deciding who was going to release the press release. So I'd like you to clarify what the decision makers mean to you. Is that, you know, the local person, the clinician, does it have to be Washington, D.C., is the White House, something like that? Because I think that tends to confuse people when we just throw out that term. So I'd love you to elaborate on that. The next is about big data and open data. And you might be familiar with the Global Virome Project. There's talk about identifying 700,000 viruses of mammals as a big initiative. In fact, China's already jumped in and said, oh, we'll put $40 million into it. The US, we don't know yet. France is interested. But there's pushback on that by people saying, well, you wouldn't want to make that information public. Oh my gosh, what if it got used, you know, maliciously, rather than giving it over to machine learning and big data to actually learn something from 5,000 coronaviruses. So this is my second one. Third one is, I think what I'm hearing you say, that, you know, maybe civil society, private sector, civil society, is going to move a lot faster in all of this than governments. And how does that position us, and what's that relationship? Because that might actually be a solution, not a problem, but I'm not sure. So I'll let you ruminate on that. You talk a little bit of that. I get a lot of pushback on predicting and preventing outbreaks, like it's not doable. And I think some of this big analysis, more rapid sharing information could help us, because we can identify where these, under which conditions these are likely to occur, and we can actually stop them. So I'd like to hear your thoughts on that. And then I would just add on, you know, on bioengineering and big bio, that I agree with you. One of the threats is we will be left behind. But what are your thoughts on unintentional consequences? I would say we talk a lot about, I would like to redefine when we're talking about these bio things, that we say they're natural or intentional or accidental. I don't see much in the way of natural anymore. They're just unintentional. I mean, raising 10 billion chickens and getting a strange flu is just unintentional. It's nothing natural about raising 10 billion chickens. So I wonder if that's going to fit into our synthetic biology world too. So that's a lot of questions, but I'd love to hear your thoughts.
Dr. Oates, you have as much time to answer as he took to ask, so feel free, go right ahead.
Okay. The audience I have in mind for the information supply chain is, first of all, the decision makers in an epidemic. And this is a layered group of people that ranges from Dr. Red and his colleagues at CDC to state health departments and indeed to the White House. But what I was thinking of in terms of the immediate next 2 to 3 years is, how do we get better real-time information about the epidemic into the hands of the people who are deploying people and so on and so forth. The whole question of, oh, we can't let that out, that's too secret, or that's too dangerous, just beleaguers us constantly in all sorts of situations. And I think I think one of the issues in biology about talking about dangerous pathogens is that we're still in shock at the notion that we could make bad pathogens on purpose or by accident, as opposed to having God, visit them upon us. And so it seems very scary. I mean, we had a long debate in 1999 about whether or not we should tell the public how few smallpox vaccine doses the U.S. had. And we decided in favor of truth and openness. And I think that's almost always the right default posture. But we have to explain it. We have to explain it. The reality is that all the information you need to do something evil is out there now, if you have the will. So this fantasy that we can keep it secret is just that, a fantasy. Civil society always moves faster than government. except when we're in dire emergencies. And then government can muster forces and create coalitions that are beyond the capacity of the civil society. And we have done that not just in the face of an emergency, but we have done it proactively. And I'm thinking particularly of the extraordinary physical science accomplishments that we have had since World War II. But I would also cite things like building a public education system, which we once had, and other accomplishments that were partly through the private sector and partly through civil society. So we have to find new ways, I think, of engaging we have to invent new ways of making these public-private partnerships. And we probably need a menu of them for different purposes. One way to really engage the public and private sectors that is tried and true is to create a challenge. Let's build a nuclear weapon to stave off Nazi Germany. Let's send a man to the moon and bring him back alive. Let's sequence the human genome, a relatively smaller project, but nonetheless the biggest big biology project we've done so far. And that is the way I would frame the vaccine challenge. Let's figure out how to make a vaccine at speed against anything and manufacture and distribute it to the world. That's a good challenge, and we have the technology to do that, I believe, or could get it in a reasonable amount of time. And I would think that that's a challenge that would excite young people, that would engage people in pharma and biotech, because it's got a lot of moving parts, and they would learn a lot from it, and would probably involve the necessity of a deep dive into immunology and how the human immune system works, which would have a lot of benefits beyond infectious disease. Let's see. I can't read 4. What was 4? Predicting, forecasting. Okay. I do not think we are capable at this point of forecasting an epidemic that is to come, depending on, we're pretty certain we're going to have a flu pandemic for all kinds of scientific reasons. But we can't say when, where, and what viral type we're going to have to deal with. I do think if we had an information supply chain that worked with reasonably limited flows of information of the right kind, we could get a lot better about predicting what is likely to happen with this epidemic, where should we deploy resources, how bad is it going to get, okay, and is what we're doing working? So forecasting, I think, to inform decisions is well within reach. We need to get better at our models. The models do get better. They did get better over the course of the Ebola outbreak in West Africa, for example, as more data came in. But the key is to have a way of collecting and curating data and then opening it all to everybody so folks can work on it and we get a very rapid sense of what's going on. And about the 10 billion chickens, humans make a lot of mistakes, and most of what we all deal with every day has to do with repairing our unintended missteps, okay? And it may be that we will learn in coming years that having 10 billion chickens in one place is a misstep, okay? And we will correct that. I would hope so. We didn't mean to awaken Ebola in the jungles of Africa, but we are going to be encountering more and more unfamiliar microbes in the coming years, inevitably because of population pressures in our travel and trade patterns. So we need to get good at managing these unintentional crises, better than we are now.
So thank you very much for just such a thought-provoking and compelling talk. You addressed one of the points I was thinking about when you said create a challenge, and what I was really wanting to get to was your suggestion for whether we need a new institution, organization, or given the agencies that we have currently in the government, do you think that they're adequate, or what would you suggest if you could wave a magic wand and come up with the ultimate funding machine?
So the agencies that we now have are not adequate in terms of scope, reach, funding, talent. We need to rethink how we recruit people to government. The current process is totally broken. I have been in new federal agencies, such as DHS, and DOE at the time was a fairly new agency. I wouldn't want to do that again if I could avoid it. I think it's very difficult to create whole cloth new agencies in our federal process. But I would endorse the panel's sense that there has to be somebody in charge, and there has to be somebody with sufficient authority to muster the kind of resources that we need and be able to speak authoritatively to the CEOs of multinational corporations, to be able to move NIH in certain directions, to be able to create flows of intellectual capital in the universities. So we don't have that institution now. Should it be built out of BARDA? Should it be built, you know, with some conglomeration of BARDA and NIH and the biotechs? That's going to take a lot of thinking. You know, the institution I'm in now, which is a nonprofit created by CIA, which is intended to glue together government, venture capital, and innovative startups, took 18 months to conceive and get on paper, and another several years before it was really working. We're now in our 19th year at IQT. So this isn't something we're going to whip up overnight. But I do think we need new institutional forms to ground these efforts.
Hi, Doctor. Thank you for coming. Just one quick question. Could you provide us with some materials or your thoughts later on about where the investments should be to accomplish this biotech revolution?
Sure. Yeah. Be happy to.
Senator Dash?
Tara, I could listen to you all afternoon. I always learn from your presentations and our conversations. I think I'd like to drill down a little bit more on a couple of things you said. One, you said that I think one of the most provocative things you said is we have failed to compete in the bioeconomy and that we need a translational infrastructure in order to do that. But then earlier in your comment, you mentioned that we've already spent $1 trillion since 1938, and we haven't got our money's worth. On one hand, it seems the answer to the fact that we've not succeeded in competing in the bioeconomy is the lack of resources that we've talked about a lot, whether it's BARDA or any one of a number of entities or efforts. We just haven't committed the resources. But in those instances where resources have been committed, you say we haven't gotten our money's worth. If we had to do a better job of getting our money's worth while more effectively competing in the bioeconomy, what would it look like?
It would look like a better balance between our investments in basic science and our investments in technology. You know, Vannevar Bush was a great American, but he did the country a disservice by presenting a model of how science works and how technology develops that is incorrect. What he said, and this has been the prevalent model in most people's minds ever since World War II, is that if the government invests in basic science and don't tell the researchers what to do, they'll figure it out, then out of the other end will come knowledge that industry will automatically put to work in translating into useful technologies, which, as we now know, are one of the major fuels for a growing economy. That is not how it works. The relationship between basic science and technology development is iterative. Okay? What's technology? Technology is the harnessing of an understanding of a natural phenomena, or more than one phenomena, to human purpose. Where does technology come from? Technology comes from the combination and recombination of existing technologies. So the more you have, the more you can build. We're in a time where we have a lot of technologies and there's a lot that we can do with them. But this iterative relationship between the practical problems to be solved by technology and the fundamental knowledge of very complex phenomena such as, biology, has got to be a ongoing conversation to be most efficient and effective. Possibly one of the greatest examples of an effective translation of basic science, the generation of basic science, and then its translation into products is Bell Labs, right? Now, Bell Labs was made possible because AT&T had a very unusual monopoly and agreement with government that it would openly license anything it invented. We got a heck of a lot out of Bell Labs. There's no Bell Labs for biology. Okay, same thing with the DOE labs. Okay, the DOE labs have created extraordinary intellectual capital and national security goods for the nation. There's nothing like that in biology. Okay, pharma has really been the main translator until recently, until the 1970s, of basic science into products, and they have a very hard job. Okay, that is a very difficult and until recently mostly empirical trial and error process. Okay, right now pharma is chained to their quarterly reports and is more intent on profit than on helping humanity. And I say that having the greatest respect for many of the people who are working in the industry and working very hard. But the reality is they're mostly owned by hedge funds. And we know what they want, okay, and how they force their companies to pursue profit. So since the 1970s, these small companies, what we now call the biotechs, who were usually three smart guys and a dog coming out of universities who had a good idea, have been phenomenally creative and have given us all kinds of projects, including most of the genomics revolution, and now the synbio revolution. And they have been very active and very productive, and my hat is off to them. But if we really want to build an economy that has the translational power that we need to compete against China, for example. And by the way, 20 countries have strategic bio initiatives for economic purposes. This is not just China. They are just extraordinary in how serious and aggressive they have been. But if we really want to compete, then we should, and if we want to solve some of the biggest problems ahead of us, and that's a whole other conversation, then we are going to have to build a very robust translational capacity for all of the biology that we have learned and are continuing to amass.
Everything?
Briefly, thank you very much for your remarks.
Sure.
Fascinating. You had strong words about the government's, I think it was talent development or recruitment efforts, that they've been a failure. Mm-hmm. Would you expand on that? So what specifically does government do wrong in that respect?
Well, first of all, it's impossible to figure out if there's a job available. Mm-hmm. Okay. The website is pathetic, an embarrassment, and useless. Okay. Secondly,
anything else?
I know we're time limited, so
as many adjectives as you want.
It's great to be out of government, actually, and be able to say these things. Secondly, the HR system has just basically collapsed. Okay, you can't hire people. If you have somebody you know you want that person in, and they're very talented and totally qualified, and they want to come in, you can't get them in. Okay, you just can't. It took me over a year to get a fellow who was a presidential appointee in DOD to move to DHS, okay? and everybody agreed it should happen. We just couldn't get it done. Getting somebody new in is very difficult. Government is the opposite of what the millennials are looking for as a workplace, okay? It is hierarchical, it is bureaucratic, it is stupid in the sense that we have laws and rules and procedures that were sensible once and no longer are, but we don't have any way of renewing our procedures that works very well, unless a secretary takes it on. I was in government when Vice President Gore initiated the reinventing government effort, and that made a difference. We got rid of a lot of regulations, for example, in DOE that we no longer needed, and it encouraged people to look at things anew. We need something like that, I think. But if we don't figure out how to recruit the next generation into government, we're cooked. And as far as I can tell, we're not even thinking about it.
Well, I'm going to ask one final question, but I think on behalf of the panel, we thank you for your participation, your very provocative testimony. And I love the three-point plan. We'll call it the O'Toole plan for a better, for a stronger. No, I'm not going to say for
not
greater
a good idea.
bio. You're going to take. I'm not going down that path. Your first point was with regard to what I really thought was really intriguing to me, and that is all the information that government generates in the biofield, whether it's CDC, NIH, academic research sponsored by public money, any of those public, the whole notion that that becomes available to everybody, the small startups, the big boys, seems to make a great deal of sense. So if you were looking at the universe of depositories of information, I mean, I'm thinking in my own mind, and you've been down this path. Clearly, you can get pharmacological information and the public health information, you can get diagnostic information. That's one set of information. You got all this research going on in government institutions, publicly funded. That ought to be in the public domain. Research that they're doing in the FBI, CDC, NIH, that ought to be in the public domain. Who would oversee all the collection? I mean, access is one thing, but who would oversee the collection? And what organizations would you mandate? You're getting public money. This is research that should be used in the private sector. Report in. Where would you go?
Well, I think many agencies are trying to do this already. For example, FDA is very interested in how they could make their reams of clinical data available for further research in a way that protected patient confidentiality, but put all this knowledge out there for others to work on. NIH also is trying to go open source and make sure that people who get their grants put their data out for inspection. And there's a huge furor going on right now because Europe has insisted that anybody funded by European research money has to publish all their data. So this would be a very controversial move, and to do it, you would have to go step by step. But this is the age of big data, and we will move in this direction one way or another. I would do it agency by agency. I would learn from one agency how to do it in the next agency. You would have to create, I think, some kind of interagency governmental enterprise, and you would have to bring in skill sets from outside the government that we do not have now. I will say that this pharma executive with whom we spoke noted that it took his company, a very big company, 5 years to get some of their past data organized and online so that the whole company could have access to it and use it, because the companies are all stovepiped as well, sure. Right? So it is a humongous task, and would not be easy, but we should think about it. We should really examine it, and going forward, we should make that kind of a hallmark of the way we do work.
Colleagues, anything else? Have you written on that at all? I mean, this is very provocative. You've done quite a bit of writing, but have you laid out?
No.
Okay, I'm very curious. I mean, just treat the notion of a central repository that large companies and small companies can draw on. I'm a little adverse to an interagency group working on it because I was part of an interagency group, and they move at glacial-like speed. And, you know, there's a tendency in this town to protect information because we overclassify everything. But I'm intrigued by that notion. It makes so much sense because all these small farmers, it's true, our friend Jim Greenwood is in here, who represents the industry of the small biotechs.
But this is,
So they got all that information out there they could add to theirs, and who knows what.
I mean, this is a real theme in cancer research
attracted by that
right
notion.
now.
Question?
No, just first, sorry I had to go out to a meeting, so I couldn't hear you. Secondly, thank you, because you're really one of the people who first educated me about the biodefense right when you were at DHS and when I read your stuff. And the third is I haven't seen or heard you for a while, but it's very reassuring to see that you haven't lost your straight talk, cutting edge qualities. Just in the few minutes I've been here. So thank you. I look forward to seeing you again, and I don't have anything else to say except everyone here, thank you for being here, and go in peace.